My question is, if I'm a long-term care pharmacy, I've got a large unhoused mental health issue, and I would like to get out there and start, growing my long-term care pharmacies. What would you advise for those pharmacies to start? Here's what you need to do to kind of set this at-home mental health system up in place.
A really costly thing that I did, but hospitalizations are a huge bugaboo to everybody because the hospital, once they're in there, A, it's expensive, and B, there's a very challenging process in discharging people. Somebody's in the hospital. Actually, I should say, if you know somebody's in the hospital, you know why I'm saying that in a minute. You get about 2 hours between when the doctor discharges them and when you got to have the meds ready. And it's complex because these people are sometimes on 15 meds. There's this thing called Current Connect in the state of Rhode Island, which is essentially software on the back end that Medicaid and Medicare can see every hospitalization and every patient in the entire state. We would find out about a hospitalization sort of after the fact. And if you guys are LTC pharmacists, you're billing and filling 10 days before somebody needs the meds, and 6 days before their meds hit, suddenly in the hospital, you're kind of waiting. What's going to happen? And sometimes we're waiting ignorantly. We had no idea somebody was in the hospital. Getting connected to Current Care gave my pharmacists, particularly my VP of Compliance and Strategy, direct insight. When we knew somebody was hitting the hospital, sometimes we were telling the nurses of the facility, hey, Sally hit the hospital. Did you know that? Oh, okay. So now we're ready for those kind of transitions, and it's less like getting hit with a baseball and all you heard was the crack and you turned around, there it's coming at you. We know it's happening. It gets the team prepared a little bit more. And what I was able to do initially is I was willing to take the cost, but I did the same thing I'm speaking to you to the state and saying, do you really want to charge me $45,000 a year for this little tiny LLC to get insight on what's going to help you anyway?
Right.
And they significantly discounted the cost. For me to do that because the insight mattered that much, particularly to the Medicaid roles here, which is, again, about 80% of my business. So it was actively getting engaged, going back to your initial question, how does somebody get engaged in this? Talk to your community mental health centers. Talk to your Medicaid representatives. They know where the pain points are in the state. Of course, there are bigger states than others.